This is the context. Southwestern Antioquia, a region full of coffee fields where the Christiania Reservation is located, populated by 1,746 inhabitants. They belong to the Embera Chami group. This zone is located 2.5 hours away from Medellin, one of the most important cities in Colombia. To this southwestern Antioquia community comes a research team of social and health sciences professionals composed by native community members and an academic staff. This team is willing to go with its population, to learn with them, and most important, to build a different vision about HIV and other sexually transmitted diseases, a reality that these Christiania inhabitants have been struggling with since the diagnosis of the first HIV cases a few years ago, and thus start the show. In the first phase of the project, the team did HIV, syphilis, and hepatitis B rapid tests to 285 native people who voluntarily participated. Those results showed facts about the prevalence of these infections. At the same time, the research team obtained information about risk factors and sexual behaviors of the surveyed, data that would let design the intervention process. Home visits. Assessment and follow-up of the people living with HIV and their families.
El condón se pone en esta posición.
Training guidelines to native people who work at the coffee crops during the harvest.
Sin protección, porque las personas muchas veces tienen la infección.
Radio shows. Education and empowerment of the Iabuma leaders. HIV Prevention Festival. Among other actions made in collaboration with the staff of the local hospital, we have been doing towards the STI prevention and the patient's care. Among other actions made in collaboration with the staff of the local hospital, we have been doing towards the STI prevention and the patient's primary care. Different methodologic strategies have been implemented, looking forward to transfer information in a culturally appropriate way, considering the interests, motivations, and artistic talent of the community teenagers and adults. It was intended to strengthen a theater group followed by an artist and an acting professor, who were in charge of setting up a theater play that will reflect HIV infection risk factors from their own experiences. A piece which motivated the community to think about its reality. The play, Health, Mind and Land. They're one. In this piece, the traditional healers, prostitutes, molesting parents, alcohol and psychoactive drug users, and the lack of accompaniment of the young population are part of this community's reality. Experiences they pass through because of transculturalization, situation that makes them incorporate practices and behaviors of the non-indigenous countrymen who live within the region.
Siempre con los mismos tiros alas. ¿Usted por qué no cambia un poquito de presencia? ¿Qué más quiere?
This is what theater contributes as a strategy of HIV and other sexually transmitted infections prevention among the Embera Chami. Under the idea of expressing freely what they are, what they live, what they think, what they fear, and what they love.
El SIDA no mata, mata el descuido, la irresponsabilidad y la falta de conocimiento. Gracias.
With this experience, and despite the obstacles to sync up schedules, disciplines, diverse conceptions of rehearsals, and timings, it's been possible to verify that art, in this case theater, permits putting on stage what the actors live daily. It's important to visualize in this intervention process that the culture concept today contains, in one side, the artistic creation, and on the other side, the lifestyles, rules, beliefs, traditions, social practices, even the imaginaries and representations about health and disease made by the Embera. Quoting the words of the indigenous leader Gladys Jagarin, a territory needs traditional healing plants, trees, crops, organization, culture and autonomy. It is also necessary to make campaigns about self-love, tolerance, solidarity, respect to the others, because with all this, it can be possible to build the true sense meaning of community, reservoirs or indigenous people. Theater, among other art forms, could impulse giving sense again to the experiences and situations tending to strengthen collectivities, to accompany people living with HIV and to prevent sexually transmitted infections.